Some of you may have seen ads in your part of the country on TV urging women who have a high-risk family situation for breast cancer to consider getting genetic testing to find out if they're at risk. Joining us this morning is Dr. Gregory Critchfield, president of Myriad Genetic Labs, that makes one of these tests, and also joining us this morning to talk about the testing and counseling for the testing is Catherine Schneider, who is a senior genetic counselor at the Dana-Farber Cancer Institute in Boston. Let's begin with you, Dr. Critchfield. Very briefly, describe the test that your company does and how you are promoting it.
The BRCA test is essentially a spell check of two genes which have been associated with a very high risk of breast and ovarian cancer. We proofread the entirety of the two genes, finding mutations that predispose individuals to having cancer in the future. The risk can be very high, as high as 80% lifetime risk of breast cancer and as high as a 54% chance of ovarian cancer. The combined risks are very high in these individuals. The idea is, with the BRCA public awareness campaign, is to make individuals aware that if they have a strong personal or family history, they need to speak with their health care providers. It's important that they talk to them to see whether a test is in fact indicated.
So you're talking about testing for the BRCA1 and 2, BRCA1 and 2 as it's often called, and this test is done by a blood test, and the cost is roughly?
The cost of the test is $3,120. More than 90% of the charges are covered by insurance. There's excellent coverage with a broad variety of insurance companies.
All right, Catherine, what's wrong with this? I mean, if a woman has a family history, a strong family history of breast cancer, wouldn't she want to know if she might be at increased risk because of these genetic mutations?
Absolutely. This test has been a very valuable contribution to families at high hereditary risk of breast and ovarian cancer. What isn't explained quite as thoroughly is that only a small percentage of patients with breast or ovarian cancer actually have this strong hereditary alteration or genetic factor. The vast majority of cancers are actually caused by a combination of factors that are not going to be picked up by this genetic test.
But in this case of this test, it has to be ordered by a physician. Women can't just go out and get it on their own. So doesn't the physician ordering provide a screen to make sure that the women who really need it or might benefit from it, that relatively small percent you refer to, are the only ones who are going to get it?
My hope is that this ad does raise awareness and education that these tests are available and that they're a forum for asking questions, absolutely, so that patients can go to their doctors, get more information about the test itself, and hopefully are referred to specialists such as genetic counselors who can go through the family tree, because often it's the pattern of cancer that really makes the determination as to whether this is a valid test or not. Sometimes it's not the woman who's initially asking the questions who's the best person in the family to test, to give the family that critical, definitive information. And sometimes it's just information that's extremely powerful. There's a lot of emotional ramifications that go into finding out whether you're at high risk or not. So we will go into that as well, about whether this is the best time in your life to be tested and whether you've really thought it through.
Dr. Critchfield, do you think that most primary care doctors or general internists are equipped to counsel an individual family and a woman about whether or not she should have the test and then to discuss the results?
That's a very important question. The medical societies to which many physicians belong have published guidelines that give red flags that help them to identify patients who are at risk. These medical societies have conducted a large number of medical education events for their members. They've been very active in making sure that their members are aware of these technologies and have given them guidelines on how they should operate with their patients. The important thing to know is that even though the tests have been around for more than a decade, that a very, very small number of individuals who actually carry mutations have been found to date. It's very important that we do a much better job and get the word out and have patients talk to their doctors who can use the society guidelines and correctly select patients who are good candidates for the test.
All right, we're out of time. This goes so fast, but we thank you both for joining us. Certainly have raised awareness of the availability of this test and the importance of good counseling in terms of deciding when to have it and how to interpret any results. Thank you both for taking the time to join us.
Thank you.
Thank you.
And we thank all of you for joining this edition of Healthy Life. If you want more information on breast cancer, we urge you to go to our new website at abcnews.com. Click on the health page, go to the breast cancer website. Over 300 questions and answers from 65 experts from around the country. It's a wonderful resource. We urge you to use it. Thank you for joining us. I'm Dr. Timothy Johnson.